Hi everyone, my name is Amrita Shekhar and I work as a Senior Program Officer, Innovative Health Tools at the Bill and Melinda Gates Foundation, India Country Office. Over the next couple of minutes, I'll walk you through both my leadership project and my leadership journey. My leadership project marries my twin passion of health innovation and making the space more inclusive for women. Now, here are some facts. 43% of global entrepreneurs are women. This number in South Asia is 20%. 35% of women entrepreneurs have faced gender bias. 15% of Indian unicorns have women founders. Through my own research, 20 to 25% of women have been supported through Indian incubators and grants. Why is this important? Having more women in the health innovation ecosystem, I believe, has the potential to transform the way healthcare is conceptualized and delivered, along with the potential to transform the economy. As more women enter this space, it will create solutions that are tailored to the wants and needs of women and society. Therefore, to understand the barriers and challenges that prevent women from entering this space, I have followed a combination of secondary research, semi structured interviews with stakeholders, and getting gender disaggregated data from academic incubators and funding bodies. The questionnaire is designed to understand both the sectoral and gender specific sectoral challenges. The women interviewed are between 22 to 50 years of age, and their startups range from early stage to more mature enterprises. Some of my key initial findings have been while women in this space are poorly represented, the challenges come from having fewer women take up STEM and fewer women pursue entrepreneurship. While the trends are increasing, this is likely due to societal and environmental influences. Women entrepreneurs have acknowledged the strong support provided by the ecosystem of incubators, government bodies, and government policies. Having women as heads of these organizations is found to be a force multiplier. Access to funding for this sector is a challenge, a fact that is corroborated by venture capitalists. The gender specific challenges are A, ability to network. This is unnatural for women and they don't have time for this. Access to mentors. And the third is the ability to have women role models who can inspire them and they can look up to. Many women interviewed also expressed a need to have more hand holding for financial aspects and commercialization aspects of businesses. Several of the women interviewed reported having faced gender bias questions from venture capitalists. This was also corroborated by venture capitalists who themselves alluded to the fact that the space was gendered. I would now like to jump gears to spend a few minutes on what this leadership project and this leadership journey with Women Lift Health has taught. My project and its approach has reflected my own authentic style of being inquisitive, pondering through available facts, and correlating them with knowledge gained through ground research. It has been both inclusive in what it chooses to understand better, that is, how to support more women in the health innovation space, as well as the inclusivity that I have felt in being a part of this journey through my peers, coaches, and mentors that have helped me in understanding my own challenges and limitations. The project has also made me be strategic and leverage my network of peers to reach out to stakeholders for my work. Like many of the women that I have interviewed for my project, I too struggle with networking, and this is a useful lesson learned. Finally, I hope that through this project I can drive more impact in the work I do by supporting health innovations that are made by women and giving them a voice and a space to actually take these innovations forward. In conclusion, I started this journey around the same time that I started a new role in a new area and a new organization. This project for me is a foray to understand a space that I am passionate about and to make that space more equitable. I'd like to end with a quote from one of the interviewees in my study. We are just entrepreneurs and much the same as men. Why do we need to be identified as women entrepreneurs? We bring a different business style, and that should just be the norm, should not need a classification. I hope that this becomes true in the near future for leadership as well. Finally, I would like to thank all my peers, my coaches, my mentors that have been an incredible part of this journey through Women Lift Health. I know that this is the start of a lifelong friendship and a lifelong journey of lessons in leadership. Thank you all very much for your time.